all the participants for spending a morning with us. Okay, I'll be talking about presbyopia and treatment options. So I'm the head of the refractive surgery department at the center. Been with the center since 1999. Okay, I think to understand presbyopia, we first need to understand refractive error. Then I'll go through the various non-surgical, surgical options and what are the future options in the horizon. Well, this is what we try not to do. Okay, so in a world without refractive errors, you want to be able to see near, far, and intermediate well without the need for glasses. However, not everybody is blessed with good vision. The different types of refractive error includes myopia, hyperopia, astigmatism, and what I'm going to talk about, presbyopia. Okay, for us to work, just now Hong Xin already mentioned different part of the eye. The function of the eye is to focus light onto the retina so that our brain can interpret the images. And in order for that to happen, the cornea has to focus most of the light onto the retina, but the lens allows for fine focusing, allowing it to change its shape. And this lens is almost like autofocus function of the camera. Therefore, it allows us to see far and near when it's working well. So in order for us to have very good vision, we need all the parts of the eye to work correctly, and the light must be focused on the retina under all conditions. When they're not in focus, that's when we have blurred vision, and that's when we have refractive error. So in myopia, which is very common, patient can see near well, but distance object is blurred. And this is because either the eyeball is too long or the power of the cornea or the lens is too high. So the focus is in front of the retina, and the simplest solution is to wear concave glasses. In long-sighted or hyperopia, this is not to be confused with presbyopia. In long-sightedness, which is more common in the West, patients have more difficulty seeing near. And this even when they're young. And the reason is because the focus point is behind the retina. Either the eyeball is too short or the lens or cornea power is too low, and they need convex lenses. Astigmatism or shangguang, very common. Okay, a lot of patients have it, but they may not know it. It's because the shape of the cornea is a bit more curved in one direction compared to another direction. For example, the lemon versus the orange. And when this happens, the focus point is on different parts of the eye. Maybe this is what happened to the tower. And for astigmatism, it causes blurred vision for both far and near, and can happen with both myopia or hyperopia. And treatment involves wearing a cylindrical lens. So now go on to presbyopia. So presbyopia is not a disease, it's a natural part of aging. It affects everybody above the age of 45, some younger, some older. Even if you have good vision when you're young. If you're like John, when you start to put your reading material further and further away, basically it means that you have presbyopia. So it is because of the inability of the lens to change its shape. Okay, so it impairs the focusing for near, and it worsens with time. So this video shows what should happen in normal lens. You can see the lens should be able to move. Okay, and on the left, a young monkey where the lens is very flexible, where in the right is an old monkey, the lens is no longer able to change its shape. And this is the muscles. The left eye, the stereo muscles are working well, and the right, the older monkey, is not working anymore. And that's what happens in presbyopia. Our lens is unable to adjust for near distance. How does it affect our lives? It reduces our ability to see near, makes reading difficult, makes near work very difficult. And the simplest solution is actually glasses. If you wear reading glasses, you will be able to see near. There are different types of glasses, each with its own pros and cons. There are single vision lenses, bifocal, trifocal lenses, progressive lenses, and a discussion with a good optometrist is needed to see what is best for you. But of course, a lot of people may not like glasses. They think it's a bit awkward. They're not used to it, inconvenient to carry around, cosmetically unappealing. So what can be done? One solution is contact lens. You can either use monofocal contact lens for using monovision. That means one eye for far and one eye for near. There are now multifocal contact lenses available where you can put in both eyes to see far and near. And there are different types. Again, a discussion with your optometrist will be the best to see which is the best suitable for you. Okay, the current surgical alternatives to reading glasses, the aim is really to reduce the dependence on spectacles, and we cannot restore the working function of the lens. So we are unable to actually revive or restore. Therefore, all the surgical technique works by altering optics of the eye, and therefore there will be some limitation and compromise. Monovision, as I alluded just now, can be done either using contact lens, or it can be done by performing monovision laser, LASIK, where one eye is fully corrected for distance and the other eye for near. Okay, so we already know what is a refractive error. Excimer laser works by using laser to change the shape of the cornea so that the focus point is now on the retina. And LASIK is a two-step procedure. It involves creating a flap, either with a blade, or nowadays we use laser. And subsequently, we use excimer laser to change the shape of the cornea before repositioning the flap. So monovision LASIK allows functional vision without spectacles. Usually, we leave the non-dominant eye about 100 or 150 degrees of short-sightedness. It's usually best for patients who have tried monovision contact lens, but some patients may have difficulty adapting to it. So these are some limitations of monovision. There's some loss of depth perception. It may affect some activities like sports. Some patients may experience eye strain on prolonged use, and not all patients can tolerate monovision, and some will still require spectacles for certain activities and with age. Just now, Dr. Melissa Wong talked about cataract surgery. So as you know, cataract is the lens which is opacified. And during cataract surgery, we actually remove the lens and replace it with an artificial lens. And the good thing is the artificial lens can be adjusted to your refractive error. So this is an eye after cataract surgery. You can see that the lens is in the back. You can't actually see the lens. A lot of people ask whether they can actually feel the lens or see the lens. You can't actually see the lens. Okay, so how do we treat refractive error? All of us like 3-in-1, 4-in-1 solution. So the good thing about cataract surgery is it can correct your vision, correct myopia, hyperopia. If you have astigmatism, you can correct astigmatism. And if you have presbyopia, we can also help. So it's a 4-in-1 solution. Okay, so monofocal lenses, it allows you to see far, but for near, you need to wear reading glasses. In some people, we can perform monovision. That means one of the lens to see far and the other lens adjusted to see near. If we do not want glasses after cataract surgery, nowadays we have advanced lenses aimed to reduce the dependence on glasses. We can correct astigmatism, we can correct presbyopia. So the new lenses usually have all these rings, is to allow the different focuses for far and near. And nowadays, the multifocal lenses are for trifocal designs. And the aim is really to allow you to see near, intermediate, and far without need for glasses, because nowadays we know a lot of people use computer, so intermediate distance is getting more and more important nowadays. We also have extended depth of focus lenses where there's less of these rings, allows you to see far and intermediate with less night vision symptoms, but you may still need glasses for reading. So there's a wide range of lenses, and usually the doctor will have to discuss with you on your preference and what you want after cataract surgery. So to summarize, there are different types of lenses. In a nutshell, 3 main types. Monofocal, it allows you to see good far, but intermediate and poor and near is not so good. You need reading glasses. We can use the monofocal lenses to do monovision. We have multifocal or trifocal lenses, gives you good far vision, good near vision, and fairly good intermediate vision. However, there's potential risks like halos, glare at night, and reduction in quality of vision, and cannot be used in post-LASIK eyes. But this reduces the need for spectacles. We also have extended depth focus lenses where it allows you to see far and intermediate, not so good for near. You may still need reading glasses, okay, but less of night vision symptoms. Okay, and results with current presbyopia lenses are very good. This is my result for past 150 cases. Generally, a lot of patients do get good far vision and near vision uncorrected. So in general, for patients with cataract surgery with advanced lenses is a preferred option, but of course, they may need to discuss with the surgeons on the appropriate lenses. Okay, the near future is very exciting for presbyopia because there are things in the horizon. Because as I mentioned, current current solutions may not be able to help everybody. There are some presbyopic eye drops which are still undergoing safety trials, and most work by constricting the pupil to increase the depth of field. However, there are some possible issues like headache, inflammation of the eye. There's always risk of retinal detachment. So majority of these lenses are actually, majority of these eye drops are undergoing safety trials, long-term safety trials to make sure that they are safe. But this may be available in the near future. If you may or may not be familiar with ICL, just now we talked about cataract surgery where you actually have to remove the cataract, but what about people who do not have cataract? So there's some hope. There's some lens available in the horizon where you can put inside the eye with eyes without cataract until they develop cataract, and this allows them to see far and some intermediate distance. So it's a EDOF or ICL, but again, these are still in the studies. Corneal inlays. In general, we can put inlays, which is a layer of material in the cornea to allow the cornea to be able to see near. But a lot of the synthetic inlays have failed in the long term. Currently, we are performing studies on human inlays, I mean donor corneas, to see whether it helps to see near. Okay, when we put the inlays in, but you must understand that it works almost like monovision because it allows you to see near. But when you're far, you may not be able to see that well with that particular eye. These are still undergoing trials. So if you're confused about which type of surgery, just to give a quick summary, if you have presbyopia, you have cataract, the solution usually cataract surgery with multifocal lens or EDOF lenses or with monovision. If no cataract, currently options may be a bit limited. If you're myopic, you can perform monovision laser surgery. If you're not myopic, options are limited now, but in the future, maybe there will be new modalities of treatment like eye drops or the EDOF ICLs. Okay, there are several newspaper articles which are really, because I don't really have time to really go deep into detail, but there are several CNA articles about presbyopia and what are the options available. If you Google CNA, Dr. Rosman, you should be able to find these articles. There's one recently in the last month. And this gives a really good overview of presbyopia and what are the options available. So to conclude, presbyopia is an age-related condition. Non-surgical options include spectacles and contact lens. There are possible surgical options like monovision, LASIK, cataract surgery, but each option has its advantages and limitations. But more options may be available in the future. With that, thank you so much for your kind attendance. If you have any questions, I'll try to answer it later. Thank you.